But first, my thoughts at the end of day 44, America in shutdown. Now, remember back in March when New York Governor Andrew Cuomo gave this very ominous warning.
We are your future. Where we are today, you will be in 3 weeks or 4 weeks.
Well, that forecast wasn't even close. There have been 23,384 deaths in the Empire State as of this evening, meaning the death rate there is 120 per 100,000. The next highest death rate in COVID is New Jersey, with 6,771 COVID deaths, or 73 per 100,000. Now, New York is and always was in its own category of coronavirus suffering, and they did suffer and continue to. But it's certainly not like Florida, which locked down later than most states and is now reopening earlier.
Everyone in the media was saying Florida was going to be like New York or Italy, and that has not happened because we understood we have a big, diverse state. I have less than 500 people at a state of 22 million on ventilators as of last night, and I have 6,500 ventilators that are sitting idle.
So it's worth asking, why are states with far less severe outbreaks, states that happen to be run by Democrat governors or blue state governors, like Virginia and North Carolina, why are those still under strict lockdown measures? Well, they claim they're following data, so let's actually look at the data. Virginia's death rate is 20 times less than New York's at just 6 per 100,000, for a total of 522 Virginians lost their life to COVID. Of course, every life lost is heartbreaking. It is tragic. There is no doubt about it. But what about the Virginia lives lost due to skyrocketing unemployment or increasing substance abuse, mental illness, domestic abuse? Georgia and Florida, which are both headed by conservative governors, we know are already opening. They're taking a whole-of-state approach to the situation and receiving nonstop criticism from the left for doing so. Well, the Angle warned you weeks ago that liberals would try to keep their states locked down as long as possible, whatever their actual COVID numbers were, regardless of the economic carnage that this was causing. Now, Virginia Governor Ralph Northam is really in a category of his own. He wants to reopen as slowly as possible.
We need to see the percentage of positive tests and the number of hospitalizations both track downward over 14 days. Enough capacity in our hospital beds, we need to sustain our PPE supply. We cannot and will not lift restrictions the way you turn on a light switch.
Where's up, Virginia? The numbers in Virginia are low. They're among the lowest in the country. Now, North Carolina has even a lower COVID death rate, 3 per 100,000, which is 40 times less than New York's death rate. Of course, Democrat Governor Roy Cooper there was unmoved by the data, and last week he extended his state's lockdown until May 8th. Makes no sense. Well, North Carolinians didn't take kindly to that. Protesters stormed the state capitol yesterday to demand that Cooper rescind his stay-at-home order. Well, what did the state do? The state responded by arresting 4 of them, including an organizer, for merely stepping onto the sidewalk outside the governor's mansion. I kid you not. My question is, where's the media? Now, the First Amendment exists to do what? To ensure that we, the people, retain our right, not to just say stuff that people agree with, but to speak out against the powerful, and especially our politicians. That's the whole point, isn't it? Or does our press believe that free speech is only worth protecting if it supports issues they like gun control, women's rights, climate change? Well, the truth is, this COVID crisis has exposed the American media for what they are. These people are control freaks. Now, check out this headline from CNN. The article says, China, despite being where the virus first emerged, has coped with the ensuing pandemic far better than many other countries. The article goes on to tout the, quote, benefits of a strong government and centralized planning, while exposing the limitations of private industry to respond quickly, particularly in the healthcare sector. Centralized planning and limitations in private industry? I'm going to translate that for you. Communism good, capitalism evil. That's shorthand. Now, in authoritarian regimes, the elites don't serve the working people. We know that, right? They rule over them. Social control over large populations is achieved through fear and intimidation and suppression of free thought. Conditioning the public through propaganda is also key. New dogmas replace good old-fashioned common sense.
The advice from the experts is clear. Wear a mask for the protection of other people. Yet the vice president chose not to.
He should have worn a mask today. I mean, there's no question about it.
You wear a mask to protect the community.
Maybe Mike Pence just wants to catch it already and be put out of his misery.
Those are nice people. Was Chris Cuomo wearing a mask out in the Hamptons the other week? Oh, maybe. Well, by the way, they'll say this whole mask thing is settled science, just like they do with climate change. Of course, it's not. And they know it. Our own experts have gone from masks aren't necessary to masks are essential. You have to wear them when you go jogging in just a few weeks' time. Now, Rush Limbaugh made a great point, as he always does, on the radio the other day, and he said the virus itself, as it weakens and states start reopening, the media that have been selling this panic for weeks and weeks and weeks, they have fewer images to sell their hysteria to justify continued lockdowns. But the masks, well, they're kind of a constant reminder. You see the masks and you think you're not safe. You are not back to normal, not even close. Well, enter Dr. Fauci.
It's not going to disappear from the planet, which means as we get into next season, in my mind, it's inevitable that we will have a return of the virus, or maybe it never even went away.
But wait a second. On what scientific basis is he saying this? Is it settled science that this coronavirus will come back for sure in the fall? No, it's not settled science. Here's a totally different view from France's preeminent infectious disease expert, Professor Didier Raoult.
This curve is called a bell curve. This is the typical curve for epidemics. Most of the time it goes like this. So the rebound story is a fantasy that was invented based on the Spanish flu, which started in the summer and therefore has nothing to do with this. Epidemics begin, they accelerate, they culminate. This is the moment of maximum transmissibility, and then they decrease and they simply disappear, and we don't know why.
Remember, the last bad coronavirus we dealt with was SARS. It started in November and it ended in July. Now, why aren't any media types here questioning Dr. Fauci's assertions? No disrespecting his amazing experience and all the work he's done, but that's quite an assertion, and it spreads absolute fear and panic. And why isn't any good news in this fight against the coronavirus ever taken to heart? It's usually dismissed, by a lot of the experts and most of the blue state governors. Well, the answer isn't based in science or good journalism, perhaps. So the only answer is that election year politics is trumping practical thinking and perhaps even trumping real science. Now that is a national tragedy, if that is the case. And those are my thoughts at the end of day 44, America in shutdown.